If you have traditional Medicare, as long as that provider or facility or company is a Medicare provider, you're fine to go to them. What that means is that they accept amount that Medicare pays them. Medicare pays 80% of that, what they call an allowable rate. And then you would be responsible for 20% unless you have a secondary or a supplemental plan. If you have a Medicare Advantage plan, there's a wide array. Sometimes it can be a PPO plan, sometimes it's an HMO, sometimes it's a POS, which stands for point of service. All of those have in-network and out-of-network providers. 99% of the time, if you have an HMO, you have to go to an in-network provider. And you also need to get a referral from your primary care to go to a specialist. If you're going to go see a specialist, you will need to get a referral. Usually, not all the time, but usually your primary care will not send you to somebody that is not in network with your insurance. But if the insurance were to deny the claim, they're going to tell you that it's ultimately the patient's responsibility to ensure that the provider is in network. Somebody will call on the phone and say, "Hi, my name is Jane Doe, and I have an appointment set up for January 5th, and I'm just calling to make sure that you take my insurance." Okay? They provide them the name of the insurance, they give them their ID number, and the person on the phone says, "Yep, we take your insurance." That does not mean that they're in network. So when you call to verify, or if you're a patient of ours and you want us to verify, the question to ask to where you get the most up-to-date information is, I want to make sure that you're in network with my insurance. Not that they take it, because some providers, even if they're not in network, they'll still take it, but you're going to be responsible for a lot of money because they're going to get paid at an out-of-network rate, and then they can bill you for whatever's left up to their billed amount. Again, if you're a patient of ours, you can reach out to your advocate and say, "Hey, I have to change doctors next year, and I want to make sure that I'm going to somebody that's in my network." And we can call. What we'll do is we'll call not only the provider, but we'll also call your insurance company and verify that the provider you're going to is in network. So you don't have to worry about doing that. Every insurance also has a Medicare Advantage plan, has a preferred laboratory. A lot of times you can go to both, whether it be Quest or LabCorp. There are some smaller labs throughout the United States, but before you go and have your labs drawn, make sure that lab is in network. Same thing with freestanding imaging centers. You want to make sure, because if not, either they're going to deny your claim or there's a chance you could be billed for a higher amount because they're out of network. It's always good to verify with your insurance. Again, it is something we can help you out with. Our advocates are here to answer your questions, to help facilitate these things. I hope you guys have a great day.